Okay, picture this. You're in the ICU. There's a 45-year-old man, and he is fighting for his life against septic shock. It all started as pneumonia from his ventilator, but now it's a full-blown crisis. His heart is racing at 142 beats per minute, his blood pressure is just cratering, and he's got this raging fever. The enemy? A really nasty Klebsiella infection.
Now, the medical team is doing everything by the book. They've identified the bug, and the lab results are clear. He's on the right antibiotic, Meropenem. The bacteria should be completely sensitive to it. But here's the mystery. It's day 7 of the treatment, and he isn't getting better. He's actually getting worse. So what on earth is going wrong here?
And then a senior physician walks into the room. She takes one look at the chart, sizes up the whole situation, and asks this single game-changing question. It's not about the dose, it's not about the specific drug, it's about the timing. The team tells her they're giving the dose as a quick 15-minute infusion. And that one little detail, well, it changes absolutely everything.
All right, let's get into the science, because to really get why that question was so brilliant, we have to understand this one crucial concept, the minimum inhibitory concentration, or MIC. Just think of it like a battle line. For any antibiotic to work, its concentration in the patient's blood has to get above this line and stay there to stop the bacteria from taking over.
So this is where it gets really interesting. Not all antibiotics fight the same way. They basically have two totally different strategies. You've got your time-dependent antibiotics, which are kind of like a slow, steady watering can. Their goal isn't some massive initial splash, it's all about staying above that MIC battle line for as long as possible. And then you have concentration-dependent drugs. These are the complete opposite. They're like a lightning bolt. Their goal is to strike hard and fast, getting a peak concentration that's way, way above the MIC.
So let's take a look at that watering can family first, and would you look at that? There it is. Meropenem, the exact drug our patient is on. For antibiotics like these, the key to winning is just persistence. They don't need a huge shock and awe campaign. They just need to apply constant, relentless pressure on the bacteria by keeping their levels above that all-important MIC line.
On the flip side, you've got the lightning bolts, drugs like gentamicin and daptomycin. They rely on that shock and awe tactic. With these, you want to deliver the dose fast to get a massive peak concentration, basically overwhelming the bacteria in one huge, powerful blow. The height of that peak is what really matters.
So here's the crucial point. The team was treating a time-dependent watering can drug as if it were a concentration-dependent lightning bolt. They gave the Meropenem as a fast 15-minute push. The senior physician's correction? It was so simple, but so profound. Switch to a slow 3-hour infusion.
Let's actually see why this made all the difference. With that 15-minute bolus, you get a quick spike in the drug level. But almost immediately, it just plummets, and it spends most of the time between doses below the MIC battle line. And in that huge time window, the bacteria aren't just surviving, they're regrouping, they're multiplying. The antibiotic is literally losing the war.
But here, this is the solution. By stretching that infusion out to 3 hours, you get this long, sustained plateau. The drug concentration stays comfortably above the MIC for almost the entire time until the next dose. The bacteria get no time to recover, no window to regroup. They're constantly being suppressed, always under attack.
So back in the ICU, the team makes the change. No new drug, no higher dose, just a longer infusion time. And believe it or not, within 24 hours, the patient starts to turn the corner. His vitals stabilize, his fever finally breaks, the infection is, at last, under control. That simple shift in timing was all it took for the Meropenem to finally do its job.
And this really gets to the powerful lesson at the heart of this whole story. You know, it's not enough to know what drug to prescribe. Real clinical expertise is knowing how that drug needs to be delivered to unleash its full power.
So what's the big takeaway here? When you're managing a life-threatening infection like sepsis, your mental checklist has to go way deeper than just the drug and the dose. You've got to ask yourself, what's this antibiotic's strategy? Is it a watering can or is it a lightning bolt? And from there, the most vital question is the one we've highlighted. How long is the infusion? It is not just some afterthought. It's a primary therapeutic decision.
In the battle against sepsis, choosing the right weapon is only half the fight. Knowing how to wield it, understanding that critical dimension of time, can mean the difference between treatment failing and saving a life. Because when it comes to antibiotics, timing isn't just important, it's everything.